Joining us now to explain how Omicron differs from previous variants, internist at Northwell Health, Dr. Frank Contessessa, joins us now. Dr. Frank, before we get to the science, I just want to get your reaction to that nurse choir video that we were just showing.
Well, first of all, I'd like to keep it mostly positive here. My health system is very proud of the nurse choir. They brought a lot of smiles to a lot of people. I smiled watching it, and we should applaud them not only for their singing voices, but for the work that they do on the floors. We're being a little bit nitpicky. The Twitterverse gets themselves into a little bit of a tizzy. Who's wearing a mask and who's not? It's Christmas time. They're singing. They're bringing joy. Let's keep it positive, and I'm proud of the work that they're doing on the floors of the hospital.
I have absolutely no doubt that they are doing amazing work on the floors there, so we can't take that away from them. Now, Dr. Frank, cities like New York and others around the nation have had vaccine mandates and passports as early as late August, but are still being hit with Omicron. So what can you tell us about how transmissible the variant really is?
It's enormously transmissible. This week has probably been one of the more challenging weeks in my almost 20 years of practice. Challenging not because people are so sick, challenging because of the volume of calls that we're getting at the office and the panic that people are expressing at how rapidly it's coming. Probably tested, 20 or 30 people just in the office visits that I saw yesterday, and almost all of them were positive. But I want to emphasize that the cases have been really mild. I have not put anybody in the hospital in weeks. We really are seeing mild cases. So I want to emphasize calm. When you look at the numbers on CDC, the cases are skyrocketing, but there's a nice level line when it comes to hospitalizations and deaths. The hospitalizations ticked up really maybe 5 or 6%. Our hospitals in the Northwell system are doing fine. The hospitalizations have gone up just a little bit, but not in proportion to the cases. The case line is quite high, and the hospitalizations are not in proportion to it, not anywhere near what we saw in the 2020 numbers in the beginning of the outbreak.
Well, that certainly is a positive piece of data that we do have there. In South Africa, where Omicron was first detected, they went from 2,000 daily cases to over 20,000 from the end of November to the middle of December. The cases are coming down now and daily deaths didn't spike. So what does that tell us about the trajectory of the virus in the States?
I think that bodes very well for us. We can look at South Africa as a forecast of what we have to come. And I think that's very encouraging. And I've really been telling my patients, do not panic. I really see that this thing is going to wash over us. I don't think it's going to be the Category 5 hurricane that they're predicting. It's going to storm a little bit, but we'll get a little bit wet and then we'll move on and the sun will come out.
Okay, do you think people who are feeling mild or no symptoms at all at the moment should feel the need to go and get tested, considering, how packed these testing centres are and how little testing kits there are at the pharmacies that we have at the moment?
I know that there's a panic about getting tested.
Yeah.
I'm turning people away left and right. I'm doing my very best, and we all are, to accommodate people. If you're asymptomatic, we really don't need you to get tested. We don't have the capacity for it. Don't get tested if you're asymptomatic. If you have mild cold symptoms at this point, you probably should assume that there's a good chance that you do have it. If you're low risk, if you're a healthy 35 or a 40-year-old, then just kind of hang in there, assume you probably have it, and take the proper precautions. But don't flood these testing centers because we just can't handle it right now.
Okay, all right. Well, thank you so much for joining us this morning, Dr. Frank Contessessa. Thank you so much, and have a very happy holidays to you and your family.
Thank you so much. Merry Christmas to you all.
Merry Christmas.